And so the first point we're measuring and talking to people about as a fundamental pillar of health that they should understand their level is their vitamin D status and their blood. So could you explain a little bit more about why vitamin D is important to overall health and immune health specifically?
Yeah, and vitamin D, well, technically it's actually a hormone. It's produced primarily by our skin through sunlight exposure. And incredibly, many of us are deficient in vitamin D. I think partly because of the northerly latitude in which we live, but also partly because of our indoor lifestyles. We spend far less time outside. And of course, we're encouraged to wear sunscreen when we do see sunshine, which inhibits our ability to synthesize vitamin D. So interestingly, there are some studies to suggest that when you have normal vitamin D levels and sort of long-term healthy sun exposure, it actually overall reduces your premature mortality risk, which I think is really fascinating. It also has an impact on improving your ability to modulate your immune system. There was a recent meta-analysis of, I think, 16 studies, and people who had vitamin D supplementation were at lower risk of developing respiratory infections. And that was especially important when they already had a deficiency. Their risk, I think, reduced by up to a third in terms of developing things like pneumonia, influenza, or other respiratory infections. So there are a multitude of ways in which vitamin D can be helpful. We can get some from food, but honestly, most of it is not really from our food. Only a maximum of 10% can we get from our food. Things like oily fish, sun-bathed mushrooms, actually. So if you have mushrooms that are brown from having been exposed to sunlight, they contain vitamin D as well. But 90% of our vitamin D comes through our skin. And when most of us are deficient, especially if we have anything even slightly darker than a porcelain white skin tone, we may also find living in the UK, it's a real struggle to get the right amount of vitamin D for our skin. And so I would recommend supplementation to ensure that you're getting the right amount. And it is really important, I think, to have your levels checked, because you won't know exactly how much to supplement unless you know what your starting point is.
What does a good vitamin D level look like? What should people be aiming for? I mean, we've got some stats here where it says 74% of people have below optimum levels of vitamin D for well-being in the UK, which is a stat provided by Fourth Life, and they do biomarker testing. What do you look for? Do you ever test your patients and their levels?
I do, actually, perhaps more than most. And what I find is that many people have a low vitamin D, many people. And I think that anything less than 75 nanomoles per litre is suboptimal. I'd probably give them up to about 200 as being normal or optimal. And so, yeah, most people fall well below 75. I see people with levels less than 20 very frequently, which is really suboptimal indeed, and it requires immediate treatment. So I think it definitely is worth looking at, because you wouldn't know unless you tested.
So the next part of our biomarker test is the C-reactive protein, the CRP. So for those that don't know, what is C-reactive protein?
It's a really commonly tested thing in the blood panel, and it's a protein that's produced in your liver when your body is experiencing inflammation. So it's not specific to any particular thing. You just know that if it's raised, there is some form of inflammation occurring within the body.